Nitric oxide, it is a crucial player in female sexual function and pleasure. And it's not something that women often are thinking about. So what are the big things that we're talking about with sexual wellness? A lot of that centers around increased blood flow, but nitric oxide does increase blood flow. It works in the vascular system, and one of the enzyme systems is related to just the vascular system alone, the endothelial system. And so it's going to relax, smooth the muscle, and it's going to increase blood flow and vasodilate those vessels to get increased blood flow to an area. So you can be talking about the heart, coronary arteries, the brain,
or the clitoris.
Welcome to RMD Podcasts with me, your host, Dr. Deborah Durst, and I have my co-host with me today.
Hey guys, my name is Faraday Golembieski, and I am a board-certified family nurse practitioner.
So if you are new to the channel, then I hope you like the content we're putting out, and please like and subscribe if you do. And if you're a return listener or viewer, then thank you for your continued support. So I am a regenerative medicine specialist, and we specialize in sexual medicine. But we also do another podcast on just wellness, the RMD podcast. And then RevMD is our sexual wellness. So there'll be lots of videos related to that. Today, we are going to do a topic that actually crosses both. But this one is related to sexual wellness and its nitric oxide production and how to improve the female sexual experience with it.
Yep, so make sure you stay tuned to hear all the multiple ways that nitric oxide can improve female sexual wellness.
And probably the biggest point at the end, we'll talk about the little blue pill and how it can be used with women, because that's kind of what the basis for this is. So nitric oxide, it is a crucial player in female sexual function and pleasure. And it's not something that women often are thinking about. And men tend to think about this topic a lot more.
Well, men think a lot about blood flow, right? As we've said in multiple podcasts, everybody in the room knows what's going on with men. Yes. With women, it's not as obvious. Correct. So men are thinking a lot about blood flow, but really women should be thinking about healthy blood flow as well, especially when it comes to female sexual wellness.
So we just recently had a conversation about this in a social event, and just pointing out that the clitoris has erectile tissue and is the equivalent of the penis for the man. And it is erectile tissue that needs increased blood flow, and it does engorge just like the penis and the corpus cavernosum. And it was like they had never heard that before, but it is the equivalent of the penis. And so not to involve the clitoris in some way with arousal and increased blood flow and engorgement would be like having sex without the penis. So you just got to think about it. No, it's not possible. So it's very important for women, and paying attention to the clitoris and the importance of that for women is what we're going to talk about today. So nitric oxide is a substance in the body that is produced naturally, but it declines with age.
Right, just like so many other things in the body.
Correct. And it is actually produced by a couple different pathways, just to keep it very simple. And so there's an enzymatic pathway, which involves L-arginine. And so that L-arginine is converted to nitric oxide with nitric oxide synthase, and that's the enzyme. That enzyme becomes less active with age, so that pathway becomes less utilizable with age.
So that is a really important takeaway from that. It's not that L-arginine works in some and doesn't work in others. It's as we age, that pathway just isn't as effective anymore. It can't convert. So when you're taking L-arginine to try to increase nitric oxide, that's for the men out there that are listening as well. Once you're over the age of 40, that pathway really just isn't reliable anymore, and we need to go to a more natural option, which is the secondary pathway.
Yeah, and that decrease with age, gets worse as we get older. So it's about a 50% decrease at the age of 40, just so you know. And so that's men and women across the board. So Faraday's correct. That is, not as effective. It's not that it didn't work the L-arginine, and that's a common supplement that men will use to get an increase in nitric oxide and blood flow. The second pathway is a non-enzymatic pathway, so it is dependent on taking nitrates in the diet. So basically, if you don't have nitrates in, our diet changes with age too. And it does tend that we are taking less in the way of nitrates in. But you need that pathway to be more active, so you need to take more nitrates in as we get older, so that that nitrate is reduced to nitrite and then to nitric oxide.
And we can do that through supplements. We can do that through food, spinach, beets, just to name a few. There's a lot of
Celery,
things.
broccoli. If you think about
Bok
some of the
choy.
greens, arugula, which is one of my favorites, is something that, so greens for the most part, but beets is a huge one. And we are going to talk about a supplement that's very important, and that it will supply you with all the nitrates that you need, and there's actually a way to test and see that supplement is working. So
And there
you,
are a lot of supplements out there. We just have a favorite just
yes.
from use and patient feedback
And the
and the
fact that
company.
you can really objectively see that you're going to get an increase in the nitrates. So you can check it. So it has nitrates in it. You'll get a nitrite increase, and you can test that. And so I always like something objective that patients can look at. So we'll let them take that in the office sometimes, and frequently take something home to retest. And patients are very happy with it. But we'll talk about that at the end. So summary of the two pathways. Nitric oxide is very important in the body for multiple different reasons. And it's produced in two pathways, one enzymatic, one non-enzymatic. And the enzymatic one decreases with efficacy and even production period with age, and the non-enzymatic is dependent upon dietary intake of nitrates. So
Absolutely. And I think just before we get into all the sexual wellness, it's good to note that nitric oxide is also really important for immune health, nerve health, cardiovascular health. And then those all do play a part in the sexual wellness in some aspect, which we'll get into. But it is more than just sexual wellness. Nitric oxide is essential for all of us.
so we can talk about nitric oxide and what are the benefits. So what are the big things that we're talking about with sexual wellness? A lot of that centers around increased blood flow, but nitric oxide does increase blood flow. It works in the vascular system, and one of the enzyme systems is related to just the vascular system alone, the endothelial system. And so it's going to relax smooth muscle, and it's going to increase blood flow and vasodilate those vessels to get increased blood flow to an area. So you can be talking about the heart, coronary arteries, the brain,
Or the clitoris.
the clitoris, the penis. So there's all kinds of areas that you can increase blood flow. And a lot of the benefit of nitric oxide is related to that. But there's some other things that we're going to talk about. And so that is the importance of nitric oxide, a substance that is produced in the body naturally, ways to increase and maintain that with age. And the benefits are a multitude of benefits, but blood flow is the big one. And I think the key with the female sexual wellness is that women don't think about blood flow, like you said at the beginning.
They don't. They don't think about that as being something essential to them like men do. So it is something that's not really looked at or researched. I never would have thought, oh, I need to get a patient nitric oxide until we really started looking at female sexual dysfunction and really what that means, and seeing the studies behind it and the research behind it, and realizing that there is a whole portion of this that is just being missed, that's easily fixed.
Yes, I agree. So, with women and female sexual wellness, so we've already hit on one of the top benefits of that, and that's increased blood flow. So, the clitoris well, just start with the erectile tissue. So the clitoris, the part that we see, is just one small part. It's the head or the glands of the of the clitoris is equivalent to the glands of the penis, but that's the part we're seeing. We're not seeing behind the scenes. So there's two legs that come down on each side, and then there's two erectile spongy type tissue that is equivalent to the penis and the corpus cavernosum, and that is erectile tissue that needs an increase in blood flow, and so it has to engorge with arousal.
It
And
has lots of
so,
nerve endings that send signals up to the body to be able to engorge with blood and
yeah.
have sensitivity.
And that's just the erectile tissue of the clitoris. But then you have also just the clitoris in general, even the glands, or not the erectile specific, but the vaginal canal. You have to increase the blood flow to the vaginal canal as well, which also therefore results in increased lubrication.
And sensitivity
Yes.
and orgasm strength.
Yeah. All of it. And so basically, lubrication is a function of blood flow. So the more blood flow you have, the more lubricated you are. And so, everyone listening, the clitoris has 7,000 nerve endings and it is a only sensory organ. So the function of the clitoris is sensory and only in sex for women. And so that involvement of the clitoris is absolutely crucial for women because that arousal is going to increase blood flow to the clitoris and their arousal increases, their orgasmic, or even responsiveness increases. And then vaginal increase of arousal and blood flow means you have more lubrication. So when a woman is lubricated, then she's aroused. So it all kind of plays. But if you go right for penetration and you miss all the other stuff, that arousal and increased blood flow and therefore lubrication may be missed.
Exactly. And we were talking a little bit about this before the podcast. If it's not enjoyable and your body's going through changes because you're perimenopausal or menopausal, so it's painful, it's not enjoyable, it's not, I mean, all these things are going on, it's less likely to happen. So arousal is a huge part of it. It's a huge part of the sexual response cycle. And this is one supplement, one way to benefit and help and get that blood flow going to see some of those positive side effects.
This is just helping.
It's helping.
It's
It's a
just
helper.
helping.
It's a helper
Yes,
supplement.
this is the manual stimulation, a little focus on the, vaginal canal, the clitoris, and then you have a little help with some increased nitric oxide production. So, and then again, it relaxes smooth muscle, which is another very important role in the female sexual response. And there's a whole cycle of things that go on physiologic for men and for women. And smooth muscle relaxation, in addition to blood flow, is important for women in arousal and orgasmic
And we
strength.
talk about this because it affects so many women.
Very common with age. And so if we're talking about, because this specific podcast is about nitric oxide production in female sexual health or sexual dysfunction, however you want to look at that. But it can be up to about 50% of women that have, actually even more than that, that have female sexual dysfunction, which is a wide range of disorders. So that can be desire, so a hypoactive sexual desire disorder, that can be arousal, that can be orgasmic disorder, or it can be pain.
Pain.
So it's all of those, but up
It can be pretty encompassing for women.
yeah, and premenopausal, you're talking about almost half, 50% of women, about 45% of women
But
are
then
reported to have,
postmenopausal,
yeah,
70.
goes up to 70%.
70% of women. So this is important. This is why we spend time talking about this. This is why we want to have the education out there. Because think about that, 70% of women.
And about 50% of our population is postmenopausal, and about 70% of them have sexual dysfunction in some way. Well, that's a huge percentage. And guess what? Doctors aren't talking about it, but women are, or at
Or
least
women aren't
they're,
comfortable talking to their doctors. There was one statistic you showed me that it
yeah.
was like 82 or 83% of women wanted to say something during an appointment, but only 13%
Yeah.
actually mentioned it because they're not comfortable having these conversations. So it's imperative for offices like ours that this is not, doesn't need to be taboo anymore. We need to have these conversations. It's affecting many women.
Well, there is, even when I worked here, there were intakes that would like screen for certain things, right? With the prevalence of
Yep.
female sexual dysfunction, we should be screening for that in the primary care doctor's offices. Women want to talk about it. There's an issue out there, and we talk with women on a daily basis about this. So just know that it's important And there are lots of things that play into that, but nitric oxide production is a very simple thing that you can improve. And just knowing that you can improve that experience, just knowing that the clitoris needs to be involved in that importance is from, like the beginning of sexual activity to, till death.
And
It's
like until the
important.
end of
Yeah,
time.
till the end of time, until death. It's important.
I was
But
wondering where you're going with that.
I
I'm like,
know.
are you really going to put a cap on this?
No.
It's very unlike you.
Yes, no, till the end of time, death do
Till the
you
end of time.
part. So that is the role we can do.
At least
Women
that's what
need
we're here to do.
Yes.
Is
What-
so it lasts till the end of time.
yeah, that's the goals of treatment. So I think that basically knowing that nitric oxide in production and therefore a supplement that you can easily take to provide you with all the nutrients that maintain your nitric oxide production with age. And then just knowing that a little focus on some areas will increase your blood flow and your orgasmic strength and sensitivity is important. So the other thing that it affects that you really don't think about, because again, we think about blood flow, maybe the smooth muscle because it increases the blood flow, but is the effects on hormones that nitric oxide can do, the interplay between nitric oxide and hormones and,
Especially
oxytocin.
hormones like estrogen and progesterone.
Yes, yeah. And estrogen's a huge one because again, there's certain receptors and when stimulated will increase nitric oxide production. So if you're missing the estrogen, then you're missing that step. So hormone optimization is another thing that will comprehensively help address female sexual dysfunction. And then it also brain stuff, oxytocin. Oxytocin increases with orgasms, and nitric oxide is produced with that as well. And so, they all interplay together. And so it's just interesting to know that the neurotransmitters in the body are playing a role in that nitric oxide production or nitric oxide needing to be produced to
Help
help
those pathways
those hormone
and
pathways.
support those
Yeah.
pathways.
Yeah.
So it's, we talk a lot about blood flow. We talk a lot about vasodilation. So when you think about nitric oxide and how it is helping that blood flow, it's not just blood flow to the heart. It's not just blood flow to the penis. It's everywhere. So when we're talking about how it can help hormones, you're like, how does nitric oxide help estrogen? Well, if it's improving blood flow to the ovaries, if it's increasing blood flow to the follicles, if it's increasing blood flow to the uterus where progesterone is more dominant, and it is helping blood flow, which means it's helping oxygenation of the tissue, it's helping nutrients get to those organs, then we're improving the function of those organs.
Yeah.
So I think it is more than just, it vasodilates. Well, yeah, it vasodilates, but in really cool ways. And all these other organs are affected. And nitric oxide really does play a key role for that estrogen production, for that progesterone production through that vasodilation.
Yeah. Well, and if you think about if orgasmic strength decreases with time, if arousal decreases, if all of that or even dryness in women aren't having sex, because they're not having as many orgasms or it's more difficult or their drive isn't there, also sexual activity, use it or lose it is there. So the more sexual activity you have, the more hormone production, and so again, the better blood flow to all those organs that are producing hormones, but also just better sexual activity is going to increase your hormone production. But there's some nitric oxide production that is dependent on hormones being present too. So lubrication was the other one. We already talked about that because that's a function of blood flow. But one of the interesting things is that nitric oxide can, in inadequate production of it, can decrease anxiety and actually improve memory and long-term memory specifically. And so this was an interesting, point for us because
we weren't expecting that. I wasn't expecting that. I wasn't expecting to see that in the studies and in the science. So we're always learning ourselves when we kind of really deep dive into something.
Yeah. Well, and so there's a link, obviously, yes, if you're anxious, you're not going to have as good a sex drive, so yes, it plays a role, but there is an actual interplay directly with anxiety and libido and in long-term memory and libido. and you think, so yes, anxiety would decrease your libido, but memory and libido, I wasn't really thinking
No.
about that connection. But yes, it does connect. And then if you actually think about how and why, it actually makes a lot of sense because it's the sensory and the memory of, sensations. And so that sensory pathway is dependent upon nitric oxide, but then also your memory. And if you can recall the sensations and you have that imprinted in your brain, then that plays a role in your sex drive, which was very interesting. So
At least we think it's interesting.
I know, I thought it was. So there's all kinds of different ways that obviously nitric oxide can improve sexual function. So we're talking about orgasmic strength, decreasing anxiety, improving your memory, but then therefore libido, improving your blood flow,
Yeah.
and lubrication, and just hormone production overall.
Now, I
Because
do want to be clear, this is a supplement. So,
oh yeah,
if we are menopausal and we're having, or even perimenopausal and we're having night sweats and we're having low libido and low energy, and then if we're menopausal and we're having vaginal dryness, pain with intercourse, not having orgasms, we're not saying that you can just take nitric oxide and all your problems are going to go away. It is going to help. So, as Dr. Durst mentioned a little bit earlier, hormone optimization is very important and a key role in all of this. But what we're pointing out is that without proper nitric oxide, it just exacerbates those symptoms. But we still need to treat the underlying cause if our hormones are depleted. So I do want to point that out. We are not saying that you can just take nitric oxide, all your problems are going to go away, and you're going to be fantastic. Hot flashes gone, vaginal dryness gone, libido full swing. So,
yeah.
but it can help. And this is something super easy that's over the counter that you don't need a prescription for. And it plays an essential role in so many different arenas.
And I think that there's still probably a little confusion in that the supplement is actually nitrates that are improving nitric oxide. Because I really think that way back there was another product that was like almost a nitric
Yeah,
oxide.
it's nitric oxide because they all
Yeah,
say NO.
yes. And so there, what we're looking at, because again, the production can decrease with age, there are some supplements, amino acids like L-arginine, that would increase that blood flow pathway. And a reason why a lot of men, I think, use that was because of workouts too.
Yeah,
So there was muscle increase in blood flow, and
into the
therefore, yeah.
muscles.
And so it was a muscle thing, but then you had the penile effects too. Great. It works both places. And so men would use it. But what happens is that decreases with age, and even the little blue pill that people will use. And yes, women can use that too. That is dependent on nitric oxide production. And if you don't have nitric oxide production because of that decreased enzymatic pathway, then you need to take the nitrates for a supplement. So that the supplement is actually a nitrate. It has everything in a capsule form that would be equivalent to all the nitrates you needed in your diet. And so,
Exactly. It
yeah,
is. It looks a little misleading because everything says nitric oxide, but you're not taking nitric oxide. You're
yes, yeah,
taking what you need for that pathway to convert to nitric
yeah.
oxide.
And Berkeley Life is the product that we use, and there's test strips that talk about, or that actually allow you some objective evidence that your nitrates and therefore nitrite and nitric oxide production is increasing. But Faraday is correct. This is just one part of a comprehensive plan for female sexual wellness. And so just knowing that you can do supplements that increase nitric oxide, you can actually do the little blue pill or a Viagra Cialis combination, but you want to use something that, like Berkeley Life, that increases your nitrates to help that work. But hormones is key if women, because again, we're talking about estrogen, testosterone, progesterone, they all play a role in sexual function for women. And so it is important to address that if it exists, and to at least talk to your doctors about that. So I agree, it's not an absolute fix, but there are so many benefits, and that's what we wanted to touch on. And so hopefully this is helpful. If you have any comments, such as number one, does your doctor talk to you about sex? Do they screen? Do they ask questions? Have you ever tried to bring things up? Have you ever got anywhere with that. Do you have experiences you would like to share? Because we are willing to deep dive into anything sexual wellness, and we would love to hear from you.